In my view, it's impossible to rejuvenate a patient without using fat, whether it's for volumizing or for improving skin quality. At some point in the process, you're going to have to use fat. It's like treating aging only halfway. It's as if I couldn't deliver a complete result. It's like trying to bake a cake when you're missing some of the ingredients. Today, I decided to bring up the topic of fat grafting. So, I'm going to start by answering the most frequently asked questions you usually ask me here. First of all, fat fillers are different from hyaluronic acid fillers, right? Everyone asks how long fat fillers last, and I usually explain to my patients here in the office that fat grafts have an indefinite duration because they're actually cells. It's like your cell is living in one area of your body, and when I do a fat graft, I take it from that spot and transfer it to another location. So, it will last as long as that cell would have lived in its original location. It's different from a product, from a filler that you inject and that gradually gets broken down by the body. And just like with any treatment we do, right? Like with any volumization, the aesthetic effect of this volumization done with fat will have a finite duration. It will only last for a certain period because all of us will keep on aging. What we can do is make this clock of time tick a little more slowly. And when we use fat, we can really achieve that effect. Yeah, a concept that we plastic surgeons, we doctors, have been talking about a lot lately at conferences and in articles is the paracrine effect of fat, right? The paracrine effect of stem cells, which are those so-called exosomes, right? Which I believe some people here who are interested in the subject have probably come across on the internet. Exosomes are vesicles, right, with some kind of chemical substance produced by the cell. It could be a piece of RNA, which is a genetic code. It could be a protein. There can be various things inside these exosomes. And that's how the cells in the body communicate with each other. That's how they talk to one another. So, several studies, done with patients who suffered accidents, who had scalp avulsion, who had burns. Where you treat the injury site with fat and you notice, for example, that the scar in the skin in another nearby area, but that wasn't treated with the fat, also show an improvement in effect. So, this is something we already know, and up until now, we didn't have a way to explain it. And that's exactly the explanation. The stem cells from the fat release these exosomes, right? And these exosomes start mobilizing the surrounding cells so that they also contribute to improving the effect. You know, the treatment of the skin and tissue regeneration. So, this is a concept that already exists. We're learning how to use this benefit that fat also brings us, especially in the treatment of diseases, and why not take it further, right? To achieve better aesthetics for patients. And then there's the whole thing, how it should be done, what's the best way to apply it, whether you prepare it by washing, whether you don't wash the fat. Anyway, there's a whole concept that's being established for this. But there are some principles we already know. So, for example, we shouldn't centrifuge the fat, and the less time it spends outside the body, the better. So, these are two principles that we already know most plastic surgeons are applying when preparing the fat. The second most common question, right, is how much do you gain, right? What level of volumization can we achieve with fat cells? I usually explain to patients that fat is a soft tissue. It's like cotton. It's light and it takes up space, but it can't, for example, do bone restructuring because it doesn't have enough density to do that. The benefit of fat is really to improve, to add volume, to enhance the shape of the tissues, and it also has the benefit of improving skin quality. What percentage of the fat actually takes? Since fat is a living cell, it really depends on how it's prepared, how it's grafted, and what the recipient area is like where we're going to use this fat. So, for example, on the face, depending on the area of the face where I place the fat, it will take more or it will take less. So, usually, the periorbital region, right, the temples, tear trough, A-frame, these areas around the eyes, they have a take rate of almost 100%. But, for example, in the nasolabial fold area, it takes about 80%, so we can slightly overcorrect and there won't be any problem. And the lip area, which is an extremely mobile region that we use all the time to talk, to eat, the take rate is usually lower. It happens at around 50%. And these rates, they can be extrapolated to other areas of the body. So, breasts, buttocks, which are areas where we often use fat grafting to enhance results, we also have an average of how much fat actually takes. So, in the breast, usually about 80% takes. Sometimes it takes even more, but the average is around 80%. And this also applies to the buttocks area, right, to the butt. I still do a lot of fat grafting for buttock augmentation, and the take rate really is around 70 to 80%. Because it's a pressure area, we don't forbid patients, for example, from sitting. They can sit, lie down, they have a normal life, regardless of the fat graft. And how long does it take for you to see the results from the fat? The volumizing result is kind of immediate. Right after the surgery, you'll have a slight swelling, but in about 20 to 30 days, you'll already see the volumizing result. The regenerative effect, which is the one that improves skin quality, fine wrinkles, color, and skin texture, you start to see results around 30 days, and this result keeps improving over the next few months. I usually tell my patients that it takes about 3 to 4 months for them to see the final result, for example, with nanofat, and that it's normal for them to notice those slight yellowish shadows, like on the eyelid skin, for instance. Nanofat, for example, when applied to the cheekbone area, you don't see that yellowish look. But on very thin skin, like the eyelid, for example, you can see the nanofat deposit, but it fades away over the months. And the effect, right, of this fat regeneration also happens gradually over the months. Oh, another question everyone asks me about fat grafting. Do you need anesthesia? Do you need to be hospitalized? Yeah, fat filling is a procedure that's, let's say, low complexity. You just need to have the right technique and the right instruments. But since it requires collecting the fat, I prefer to do it in a surgical room. It doesn't have to be in a hospital, but in a surgical room and with the patient sedated to make it a more comfortable experience so the patient doesn't get bothered by, the fat collection with the use of cannulas, right? Especially in the eye area, the lips, which are more sensitive areas. Sedation really helps the patient stay calm during the procedure. A full face filling, for example, takes us about 30 minutes to do, so it's a quick procedure. I often compare facial fat filling to an endoscopy. It's pretty much the same protocol, pretty much the same routine. The patient needs to fast beforehand. Right? In this case, the anesthesiologist sedates the patient. I collect the fat, my nurses prepare the fat, and then I do the fat re-injection, right? In the appropriate areas and the skin treatment. And this takes about 30 to 40 minutes, depending on the areas where the patient will need to have the fat applied. We don't have a specific area. I collect it from the thigh, from the abdomen, which are the areas that are easiest to access, right? When we're operating on the face. But it can be collected from any area of the body, and I usually ask the patient if they have a preference or if there's an area that bothers them more. The area where I collect the fat won't look like a liposuctioned area. Actually, the ideal is for the patient not to notice that the area was touched at all. A lot of people are a bit apprehensive about getting liposuction because of the cannula and all that, and they ask how I collect the fat. Both liposuction and fat harvesting are done with cannulas, but they have different purposes, use different instruments, and they have different diameters and levels of aggressiveness. Usually, when I do liposuction, as you already know, I like technology. I use various technologies, and the cannulas are longer and a bit thicker. When I'm harvesting fat, I usually use thin cannulas, about 2 or 3 millimeters in internal diameter. These are very thin, very delicate cannulas that don't pose any risk. There's no problem of causing any kind of harm to the patient. On the contrary, it's an extremely superficial procedure, so it's really to demystify those fears that people have, okay? And fat does work, yes. Fat is stable and fat is predictable. Like any technique, it just has to be done the right way. I've mentioned this in other videos, but yeah, I'm going to repeat it again. The way I collect and prepare fat for the face is different from the way I collect and prepare fat, for example, to inject into the breast. And it's different from the way I collect and prepare fat for a buttock graft. So, this directly impacts the quality of the result, the predictability of the result, and the duration of the result. So, knowing the correct technique and having the right instruments is essential, okay? So, this is also something that's really important for you to understand. That's why, maybe, the results I see in my patients and that I achieve with my patients are different from what other colleagues might get. A lot of it comes down to each professional skill. And that's it for today, folks. I think I managed to answer all the questions. It was a very interesting live about fat grafts. I hope you all enjoyed it. Big kiss and have a great week, everyone.